welcome to a new episode of For Your Health. I'm your host, Jennifer Harrell, and joining me in this first half is Miss Lindsay Brawley. She is a school health nurse for Cleveland County, the Cleveland County Health Department, but she helps Cleveland County schools. And we are here to talk about spring into health and kindergarten vaccine requirements, all the fun things that we parents like to go through. So Lindsay, without further ado, let's get into Spring into Health. It kicks off this week.
Correct. Spring into Health is an initiative to project for rising kindergartners, so they can come to the Cleveland County Health Department and get their required health immunizations and their health assessment that's required for school entry. We are giving an extra incentive, so we do have 2 prizes.
Okay.
A plushie pillow for the student if they come to the Cleveland County Health Department for their health assessment and their immunizations, and then the parent gets this nice cup.
Well, that's kind.
So, yes.
Okay, so how are we learning about this? I know you and I are currently discussing it, but
Right.
if someone doesn't see this on TV or online or share it with them, how else is the health department communicating this out to the public?
It is being shared on all social media platforms, as well as all of the school nurses are sharing this information. We have K-Day coming up this Friday
Okay.
in all of our elementary settings, and this will be shared.
And as the flyer says, it says call 980-484-5100 to make the appointment. And again, as the flyer states, March 15th through
Through
June
the
30th. So that's Monday through Friday, 8 to 5, lots of options.
Yes.
Okay.
And we just encourage to call and make an appointment as soon as possible, because we hope that will get filled up. And we don't want to wait till last minute. Oftentimes, there's a lot of appointments that are made in the fall for a new school year. A lot of doctors get filled up. So this is a good opportunity to go ahead and take care of that this summer before the new school year rolls around.
And let's talk about that, because somebody could be at home and say, well, I can go to the health department, I don't have to go to my doctor, and how does that all work? So let's educate the public on, no, you don't have to go to your doctor if they're full.
Right. You can come to the health department. We do not have to be your primary care physician in order for you to utilize the Cleveland County Health Department for that service.
And insurance, no insurance?
Either.
Either?
Yes.
Okay, so again, parents, grandparents, aunts, uncles, if you're not insured, call the health department.
Right.
Okay, next we have a graphic on required vaccines. Let's go over that list of vaccines for our kinders.
So kindergarten vaccinations are required for school entry, public school entry. There you see the number of doses and the vaccines that are required, and that is part of the your appointment when you come. That will be reviewed. So if you have had your health assessment completed for kindergarten entry this year, but you need your immunizations, that can be something that you can make an appointment for directly at the health department, and you still receive the prize. So if you have your health assessment completed, but you're lacking the immunizations, if you make an appointment to come for either one of those, you do receive the prize. And I will say, if it's just for immunization requirements, that is a walk-in service at Cleveland County Health Department.
So you don't have to make an
Monday
appointment?
through Friday, 8 to, let's see, is it, they do close for lunch.
Okay.
So, but there's not a requirement for an appointment for just immunizations.
How does someone, if they can't remember what shots their child had from birth up until kindergarten, how do we access that? Can you access it for us at the health department?
Yes.
Okay.
We have access to the North Carolina Immunization Registry, so we
Okay.
can look up your student by name and date of birth and tell what they are lacking or if they're caught up.
So not to make your phone ring even more, but can that be done over the phone for parents, or do they need to drive to the health department to get that information?
Typically, we like to do that in person.
Okay.
And that's an easy something, or they can reach out to their school nurse, because all
Oh,
the school
okay.
nurses have that access to look up and communicate to the parents as well.
Okay. And I know before we went on air, we were trying to talk about well checks. Tell us, as a school nurse, what's important about these children, not just rising kindergartners, and why they should get yearly well checks.
Well, child checks are important, even if a child doesn't have a chronic illness that going on, such as diabetes or asthma, because it's a time to discuss developmental milestones with your primary care physician, and catch things that may be occurring health-wise with general blood work, things like that.
Okay.
Yes.
And then, too, you wanted to remind parents this is a good time to get their medications updated for the schools.
Yes. If your child has a chronic illness such as diabetes, asthma, epilepsy, anaphylaxis to a certain substance, then the schools do require a request for medication form, and that's a good opportunity to obtain that order for the next school year rolling around. It's good for the entire school year, but that can be obtained at your child's health assessment appointment.
And I know you and I talked about like not putting you on the spot, but I've interviewed a few of health school nurses or school health nurses. Tell us what your hardest job as a school health nurse is. I want to remind parents and guardians what all you guys do as school health nurses.
Sure. I think the biggest challenge is communicating with teachers, staff, and parents and primary care physicians. We act as a liaison and advocate for the student that they may not have, and where their voice is primarily with the ones who do have chronic health conditions. We do a lot of case management and work with those students to try to teach them how to care for themselves. And then we're responsible for making sure that they are getting the care that they need and making necessary referrals and following up on those referrals to make sure that care is secured.
So as a parent or a guardian, what can we do to better help you all?
Communicate with us. If there's any concerns, please reach out to the school nurses. They'll be glad to help in any way. A lot of it is we're the go-between sometimes just with the parent and the primary care physician, and making sure that they have access to care.
And as the school year wraps up and we're talking about springing into health for the rising kinder, it's just important, as we've already stated, for all the school-age children. But you've talked about asthma and epilepsy and diabetes, but what about how much of a role do you play in the children that might have ADHD or a learning disability? Can they come to you as a school health nurse to say, hey, I need that Vanderbilt test? Can the health department do that, or do they have to schedule it through their primary care physician?
Absolutely. We work very closely with our counselors and social workers in the school setting. So we do help advocate for that. We are not the ones who primarily give the Vanderbilt assessment,
Right.
but we can be the go-between and get that started, that conversation started with the social worker and the counselors, and communicate directly back with the primary care physician. We do give a lot of behavior and ADHD medications in the school system to help support the students to be successful while they're at school.
Right.
And those are the kind of orders that we would like for parents to go ahead and be proactive in getting over the summer when they're going to the doctor, to make sure that they go ahead and have that order obtained by their physician. And most of the pediatric offices in our area are familiar with that form. They have a copy of it.
Right. But I think it's important to note, too, for those that didn't know, the Vanderbilt test is to see if your child's ADHD, but the teacher and the parent have to fill it out.
Correct.
So I think that's important to share with all of our guardians. And is there anything else before we take a break about springing into health, or anything else as a school health nurse that you want to remind all of us at home?
I really can't think of anything. We're here for your children. And if you have any questions, please reach out to any of your school nurses.
Okay. Well, thank you so much for your time. And again, for those of you at home, please don't forget to schedule your Spring Into Health for your rising kindergartner, and please tell everyone you know. But stay tuned because we have more news coming up right after the break.
For many kids, just showing up to school is a challenge. Staying through graduation is even harder. So at Communities and Schools, we do just what our name says. Our staff brings a community of resources to meet each student's needs right in their school, doing whatever it takes to keep kids focused, so they see what we see, a bright future. Join in at communitiesinschools.org.
Cleveland Community College has identified strengthening online learning as the topic for its quality enhancement plan. We're calling it SOUL. SOUL's 5-year implementation plan is focused on continuous improvement of online courses and promoting student success. We're excited for you to take this journey with us.
The only prediction I'd make is I'd be pretty willing to bet I won't be doing it in 20 more years.
My question is, where's our residual checks?
144 have taken Republican ballots, and Wes and 2 others have taken Libertarian ballots.
Pravda, however, PBS, however.
Wes.
Well,
what?
Ladies and gentlemen, let's get ready to rumble!
Hi, welcome back to the second half of For Your Health. I'm your host, Jennifer Harrell, and joining me this second half is my favorite guest, is Ms. Deshae Oliver. She is the Deputy Health Director for Cleveland County Health Department, and this half of the show, we are going to discuss the opioid crisis, epidemic, problem, issue, funding, all the things that is taking place right here in Cleveland County, and I think you're going to be pleasantly surprised it's not as bad as it once was. So Deshae, without further ado, let's talk about what is going on. I know you said we were going to discuss opioid settlement funds.
Yes,
Okay.
yes. So I wanted to start really by just kind of sharing some of our current data and trends as it relates to the opioid crisis and how it's impacting us here locally in Cleveland County.
Okay.
But even more so than that, than just highlighting the data, but telling you what is it that we're actually doing about it? Because I think that's a lot of the questions that we're getting and what a lot of people want to know. They know it's a problem, but they want to know what can we do to actually help make it better and help combat it. But we can start by just taking a quick glimpse at the data. So what you see on the slide here is deaths in Cleveland County from drug overdoses. Cleveland County is in the orange. This is our rate per 100,000 residents compared to the state of North Carolina in the blue. So you can see while our rate has been definitely steadily increasing since about 2017, our rate is looking better than what we're seeing across the state average. So
Can we get, I want to touch on, sorry, if we can get the graphic. It looked like 14 was high. So or 15, do we know what that issue was, or it's just, it just kind of happened?
yeah, there's definitely some, major kind of spikes along the way. We don't necessarily know what specifically in those years caused those spikes.
Do we know what's causing it to slowly rise again? I know we have different numbers coming to be pleasantly surprised, but what's causing the rise now?
I think what we're seeing a lot now is fentanyl that's contributing to a lot of our opioid overdoses. I know as I've had conversations with EMS as well as people from our local emergency department. I think what we're seeing a lot here in Cleveland County and as well as across the state and other states as well is not so much necessarily that there are more people with substance use disorder, but those individuals with it are at a higher risk for overdose because of opioids being laced with fentanyl.
Okay.
And so opioids are becoming more and more dangerous,
Right.
essentially, is what we're seeing. And that's one of the things that is really driving our overdoses.
Okay. Okay. Well, thank you for answering that, because I do know people at home are going to be like, well, what's causing this?
Right.
So,
Yep.
okay. And then, because I got you sidetracked. So what was our next graphic?
So we're also going to take a look at our opioid ED visits.
Okay.
And what you see here is a little bit of the opposite, unfortunately, in that Cleveland County in the orange is significantly higher than what we're seeing for North Carolina's rate of opioid ED visits. And so I think a question that people will have as it relates to this as well is, why are we seeing our deaths improve in comparison to the state, but yet our ED visits are
rise.
significantly higher? And I think one potential answer to that question is we are getting much better at saving lives.
Oh, good.
And that, I think, is highly contributed to the availability of Narcan or
Okay.
naloxone. So when somebody overdoses, if Narcan is administered, it essentially reverses the overdose. It blocks the receptors in the brain that the opioids attach to. So essentially somebody that is in active overdose, if administered naloxone, it can actually reverse that and save their lives.
And I remember from a previous episode, some people have needed it 3 and 4 times, which still blows my mind to this day. It has
Yes.
saved their life 3 and 4 times.
Yes. So there are people that do overdose more than once.
Right.
You know, you might save their life and, you know, a week later, a month later, a year later, whenever it might be, overdose again. That does potentially happen. The other facet to that is, especially for a fentanyl overdose, because the opioids are so elevated from the fentanyl, sometimes it takes 2, 3 administrations of Narcan in one overdose to
Okay.
actually reverse that. But, you know, every time we save somebody's life, it's another opportunity to get them help, get them
Yes.
connected to resources, and hopefully help them to enter into recovery.
Right. And not to discriminate, but looking on that, is it an age thing that we're looking at, that a certain age group and population that we need to help right here in Cleveland County, or is it widespread?
So it is impacting a lot of our age groups, from, you know, our young adults to, you know, some of our older adults as well. But when you look at the breakdown of data, primarily it consists of our 25 to 34 age group.
Wow.
So
Okay.
it is significantly, disproportionately impacting our young adults.
And again, I don't want to discriminate, but I want to help. Kind of like you said, residents are calling you guys and they want to help. Is this because they have no work, or they're stressed, or they're this? Because again, I go back to an old show that we've done right here, and we talked about 40 and 45 being an age where men and women are committing suicide. So I know that's a younger age group, like you just said, 25 and up. But like, do we know the factor? What's causing it?
You know, I think for a lot of people that are suffering, unfortunately, from substance use disorder, a lot of that initially started with a legitimate prescription for an opioid.
Okay.
Whether they had an injury or a surgery or something like that, a lot of people start with a prescription. And unfortunately, over time, develop an addiction to that substance.
Isn't that scary?
It is. It's scary, which we're seeing. I think that's a good lead into
Yes.
the next data point that we were going to take a look at, was our prescribing rates of opioids, which we have seen a significant improvement there.
And that's what I wanted residents to really understand. This is the good news.
Yes, yes, absolutely. So again, Cleveland County in the orange. This is the percent of Cleveland County residents who received an opioid prescription each year. So you can see, you know, back in 2016, our percentage that was receiving a prescription was significantly higher than what it is now. So we're still a little bit above the state.
Right.
Still some room for improvement there. But our prescribing rates have decreased drastically. And a big part of that was due to legislation that was passed, and I believe it was 2017. It's the North Carolina STOP Act that actually, it did a number of different things, but it requires all prescribers and pharmacists to utilize the controlled substance reporting system so they can see
Who's
if
doing it.
patients are prescribed opioids from potentially another prescriber. It also limits the number of opioids that can be prescribed in a single prescription by a provider.
Okay. This,
So-
I mean, that's great news, because then hopefully it'll help all of our other numbers start to decrease over time. And another thing that made me think of, if someone is overprescribed and they only need 1 pill, 2 pills, no matter what the surgery or incident was, what should they do? What can they do with all that extra medication? Instead of keeping it at home, that makes them maybe want to start that substance abuse problem, what do we have available for them?
Yeah, that's a great question. So we have a number of different resources available to people here in the county. One are our medicine take-back boxes. We actually have 19 locations throughout the
wow.
county, one being at the Cleveland County Health Department. A lot of our pharmacies have them as well. You can go to our website, www.pillscankillcc.com, or you can get there from the health department's website as well to find out where the closest location to you is, so that could be an option.
Okay.
We also make available free medication disposal kits at the health department if you want to dispose of those safely in your own home. We certainly don't recommend saving prescriptions for a rainy day for later use if you don't
Right.
need them anymore. But if you have an active prescription that you are currently using that needs to be locked up or secured so other people don't get their hands on it, including young children who may be in your home, we also make available free medicine log boxes through the health department.
Great point, great point. So back to the whole crisis, I know you guys have 4 strategies, so let's make sure we squeeze that in. Which one have we not hit on yet?
Yeah, so we're really doing 4 different things, and really this all came about as part of, well, we've been doing a lot of work in this space for a long time.
Right.
But there was a national lawsuit essentially called the opioid settlement against some of our largest opioid manufacturers in
Awesome.
the country, essentially with this premise that they drove a big part of the opioid epidemic by pushing and marketing opioids as being non-addictive, non-habit forming. You need to treat pain, you need to treat pain, you need to treat pain, when truly, truly they're not highly effective in treating pain.
Right.
And it has ended up, as we talked about, getting a lot of people, unfortunately, in a place of substance use disorder. So as part of that settlement, North Carolina is one of many states that entered into that, and as a result of that, has received or is slated to receive just over $757
Wow.
million to the state. Now, what that looks like for us here in Cleveland County, it's not all at one time. It's between the years of 2022 to 2038. But over that period of time, we're slated to receive just a little over $7 million, which comes out to be about $320,000 a year to Cleveland County from essentially now through the year 2038.
Okay.
And so we've been doing a lot of work in the community with meeting with local providers, from healthcare providers, treatment providers, therapists, people that have experience living with substance use disorder, other community partners, really looking at our data, having conversations about, what is the problem and what can we do to tackle it. So we really have started with right now 4 primary strategies, but there's still a lot of work to be done and continuing to look at, what are the problem, what are barriers to care, and what can we help to do to help, get people access to the resources that they
Right.
need. So one is a community navigator
Okay.
that we're really excited about. This is in the works, in progress. So we're looking at contracting right now currently with Integrated Care of Greater Hickory. We did a bid process and different agencies submitted proposals, but they are the one that were selected to essentially hire and house this community navigator position.
Awesome.
Because what we've heard from people who have tried to navigate our behavioral health system, as well as community partners, including myself, in trying to connect people to care, is that our mental and substance use system essentially is extremely
Difficult.
hard to navigate. Knowing where to go, when to go, depending on whether you're uninsured or have insurance, or whether you need inpatient or outpatient. Is it mental health? Is it substance use? Is it a combination of the two? It's
Right.
It's really hard.
And exhausting just to hear you talk about all of it.
It
Yeah.
is. And so this is somebody with lived experience that has navigated the system, that is extremely familiar with the resources that are available here in Cleveland County,
Love it.
that is going to essentially serve as kind of a case manager to help connect both individuals seeking services as well as community partners that are looking to refer individuals to services, to connect, navigate, not only just to say you need to call, this provider, this is who you need to go to, but they could help schedule the appointments. They could potentially help with transportation.
That's awesome.
They could help with having access to a computer and internet to do things like
The
fill
things
out
we don't think
job
about.
applications and do other things that they need to do to be able to connect to resources to live a successful life, essentially.
Okay, so that's strategy one.
So that's strategy one.
What's
Strategy two, we talked about the prescribing piece. There's still additional education that needs to be done with our healthcare providers, not only around safe opioid prescribing, but I think even more so when patients present and maybe they're looking for a prescription or seeking things to help connect them to treatment.
Right.
So not only educating our healthcare providers on how to connect patients to treatment through treatment providers, but how they can also help to treat those patients through evidence-based medication-assisted treatment that they can actually prescribe.
Okay.
And so medication-assisted treatment training and substance use disorder training for our local healthcare providers is one of the other big approaches that we're taking there.
Okay. 2 minutes.
Oh gosh, okay.
Strategy
Community
number 3.
education. So doing a lot of education in the community, as I'm doing now and talking about this. A big part of that as well is education and access to Narcan or naloxone, as we talked about earlier. So just to let people know, that is available for free for anyone, no prescription necessary at the Cleveland County Health Department pharmacy. You can drive through, pull up to the window. That is available to you at no cost.
Okay. And you really do recommend we all start having one of those? Even though we don't think we know anybody that has a substance abuse problem, we should carry that in our car or purse, because you said...
never know when you might encounter somebody that has had an opioid overdose. It doesn't have to be one of your friends or one
Right.
of your family members. You could be at a public place and come across it. They say now you're more inclined to come across someone that has had an opioid overdose than you are a heart attack.
Wow.
So we train people in CPR. We also want to have people have access to Narcan. So that's a big part of that.
All right.
Yeah.
And what's our fourth strategy? Not to rush you.
The
but-
fourth one is education reimbursement for local behavioral health providers if they want to expand their ability to provide treatment for local individuals. So if they're pursuing a licensure or a certification, a lot of people might not know what these are, but if you're in the field, you would, like CADC, LCAS, peer support, RAP, any of those type of training, certifications, licensures that will enable you to be able to
Help people.
expand your work to help people that need it. We're offering up to $2,500 education reimbursement for individuals that are seeking any of those.
That is awesome. And y'all know at home, I hate to rush to Shay because she's a wealth of knowledge and information. So anyone that has any further questions regarding this settlement fund and the 4 strategies that are currently being implemented, please, please, please call the health department. The number's on your screen. I hope you have learned a great deal this episode, and you can always watch it again online. Thank you for joining us.